Good morning, good afternoon, good evening to everyone who is on this webinar. Thank you for taking the time to attend. We will start momentarily. People are still in the process of signing on to the call. Thank you very much.
Looks like we could get going, Peter.
So good morning, good afternoon, good evening, good day to everyone. Thank you very much for taking the time to come onto this call. This is the first of two Canadian IDDSI implementation forums. We are very appreciative of you taking the time out of your day to attend and participate on this webinar with us. The format of this webinar will be that there's a short presentation followed by a question and answer period. To ask a question, on the bottom of your screen, you should see a control panel or a control bar where you will see Q&A in the middle of the menu bar. You simply click on that menu bar and type in a question, and we will be happy to address it either live or if it's specific to one of the panelists on the call today, then they can actually also respond to you through a messaging system. So everybody at this point should be muted for the beginning of the webinar. We appreciate the fact that the webinar is going to be made available to other people who cannot attend today's session. So we just want everyone to know that the webinar is going to be recorded and made available on the IDDSI website soon after today's broadcast. And for those who are looking to claim a certificate of attendance, the certificate of attendance will be made available to everyone, again, after today's broadcast through an email. Following today's webinar, there will also be a short webinar survey that you will receive through the post-webinar email. We do encourage you to please fill out this webinar survey as it will inform IDDSI of any future resources that are required. We truly welcome your suggestions and comments. So without further ado, we would like to introduce the panel of people that will be presenting to you today. And on the call today, we have Katrina Steele from Toronto, IDDSI board member, Jan Duvestein, IDDSI board member from Vancouver, myself, Peter Lam from Vancouver, as well as Alan Dominguez, our communications consultant, also from Vancouver. So we will get right into the webinar for today. Katrina?
Sure. So here are our speakers and disclosures on the slide that you're seeing. And Alan or Peter, maybe you could advance to the next slide.
Sure.
So my name is Katrina Steele. I'm a swallowing clinician and scientist here in Toronto and a board member of IDDSI. And I get to start today's presentation. I'm hoping that by virtue of the fact that you've signed on today, that this is not the first time that you've heard of the International Dysphagia Diet Standardization Initiative. This is an initiative that came out of common concern. We first started in about 2012 with discussing our common concern. And really the concern was about safety for people with dysphagia related to the specification of diet textures for their diet. We believed at that time that there is real risk in having a lack of clarity in the way we describe the foods and liquids that we want to recommend for people with dysphagia. And that risk is related to providing them with incorrect liquids and foods. And so our vision born at that time was to establish a new internationally relevant framework of terminology and also measurement techniques that would apply to people of all ages with dysphagia, regardless of care setting, and would also be culturally sensitive. We can go to the next slide. So this issue of safety is something that is not difficult to find examples, unfortunately, of adverse events that have occurred related to miscommunication or misunderstanding of diet texture terminology. On the slide, you'll see quite a recent report from Ontario here, where what's described in this report is an analysis of a death that occurred due to confusion around diet texture terminology. We can go to the next slide. The story is about a 79-year-old woman who went to an emergency room with a documented risk of dysphagia. And as the scenario unfolded, she asked for a sandwich or asked for some food and was served a sandwich, despite the fact that her diet specified pureed food, and she choked to death. And in the review of that adverse event, the ministry, the coroner's office report committee here in Ontario came across IDDSI, and they made a formal recommendation in their report that IDDSI was something that governing and regulatory bodies here in Canada should be moving towards, and that as soon as IDDSI is implemented, that we all need to be working to educate, continued training for staff, so that we reduce risk to patients and residents of long-term care facilities. And so I think the thing I'd like to point out here is that the risks associated with unclear communication of terminology related to diet is really analogous to not being clear about a prescription drug, about either the type of drug or the volume of the medication in a drug. For people with dysphagia, the amount of thickener that might be required to reach the desired thickness is very analogous. And we would be horrified if there was a lack of clarity in the pharmaceutical domain, and we need to bring that same kind of vigilance and rigor over into the provision of food and liquid for people with dysphagia. Next slide, please. So as I mentioned, the IDDSI framework is that vision. And we first released this new framework in November of 2015 on our website, which you can see on the slide. And then in February of last year, 2017, we published an open access paper in the Dysphagia Journal, which describes the development of this framework, and provides also the specifications for each level. So this is a framework of 8 levels. As you can see, there are 5 levels for food and 5 levels for drink, and they intersect or overlap in the middle because really, as we discovered in our development work, it's a single continuum. There are extremely thick liquids that have the same flow characteristics and properties as pureed foods at level 4. One thing to clarify is that these levels are not diets. They are the components that go into the diets that are formed in a facility. And so the expectation is that as this becomes implemented, that a prescription or a recommendation for a diet would include the specification of a food level and the specification of a drink level. You can see that we have color coding. We have worked hard to come up with terminology that is sensible in English. That's always a challenge to agree on terminology. But the beauty of this system is that not only do we have labels for each level, but we have descriptors of the characteristics of the foods and liquids at those levels. And these are accompanied by simple testing methods that are validated and will empower end users to test a food or liquid and be confident about where it fits on the framework. And that applies, of course, to healthcare professionals and individuals in kitchens, but perhaps even more powerfully becomes an opportunity for the patient or their caregivers to have confidence about the suitability of an item for that person. We can move forward. So as we published the framework, we then had an opportunity to think about what it would take to implement this framework on a global level. And we came up with what we call the MAPA model of implementation that you can see here on the slide. And different countries around the world are at different stages. And even within a country or a city, there will be different facilities that find themselves at different stages within this model. And IDDSI's board of directors has committed really to staying with this project through this MAPA phase as we move towards global implementation. And so today's webinar is to take you through where Canada sits right at the moment. We can move to the next slide. So globally in Canada, we would characterize our current stage as being in the prepare phase. That is that there has been an initial foundation of awareness established. There have been quite a number of different presentations and workshops convened, and we are aware of many, many local implementation projects in different facilities. Importantly, we've engaged partners on the industry side. And so as you'll hear today, those industry partners are working actively towards things like transitioning the labels on their products. We've had formal support announced for IDDSI implementation by a number of professional organizations, including the National Associations for Dietetics, Speech-Language Pathology, and Occupational Therapy. And we're beginning to see now ministry level engagement of the IDDSI implementation process, such as the item shown on the slide in British Columbia, and other action groups forming. Next slide. So where are we in terms of timelines? The grand dream for Canada is that we will go live with formal IDDSI implementation on January 1st of next year. So we are sort of 9 months away. And so what does that mean? What we mean by implementation is that, in particular, that commercially available products for people with dysphagia will be displaying IDDSI compatible labeling. They might display dual labeling, so they might be in a transitional stage of showing the old terminology and the new, but by January of next year, we want those products to be declaring appropriate consistency labeling according to the IDDSI framework. And the industry sector in Canada is on board with that target date. This also means that we hope that facilities that use those products or make in-house products will be working towards implementation in their facilities. And so today we're going to be talking to you about the steps that will be required to move towards that status. So with that, I'm going to hand over to Peter to talk to you about some steps you might want to take in starting implementation of IDDSI in your facility.
Thank you, Katrina. This next portion of the webinar is really focused on the implementation. Many people have actually contacted us and asked us about how do we even get started, because it feels so overwhelming. And so IDDSI has put together the 10 simple steps to get started. Consider this the IDDSI implementation 101 slide. We are in draft at the moment, but we will have this polished and available on our website shortly to you. So to start, we truly would encourage everyone to just become familiar with IDDSI. Along our travels, what we're still hearing is a lot of people comparing the IDDSI terminology to the existing terminology that are currently being used. And there is still a bit of confusion with regards to some of the textural levels. For example, people are calling the soft and bite size just simply soft, or they change the term and call it easy to chew. There are some people who are using the minced and moist terminology and IDDSI level 5 synonymously with finely chopped, or what they are currently producing as minced. We do encourage people to go through the detailed definitions, the testing methods, the frequently asked questions, and the resources that are now available at iddsi.org/resources. For those who are not aware, we do encourage you to download the free IDDSI app. The detailed definitions, testing methods, along with the videos for testing are all available on that app, and you can operate it without the need for Wi-Fi or data. So while you're in your commute, that's a really, really good time to review the IDDSI definitions, or if you are stuck in a meeting somewhere and you're absolutely bored, pull out your IDDSI app. No, we're just kidding. Please don't do that. And then finally, do sign up for newsletters, because that's what's keeping everyone informed then of what's happening with IDDSI and the implementation progress. I'm going to now hand it over to Jan, who will walk us through a little bit more on what you can find on our website.
Okay, so thank you, Peter. As Peter's done a sort of given you the broad strokes of some of our resources, but I'd like to dig a little deeper and take you on a bit of a virtual tour here. We've created a number of these tools that we hope will be very helpful for you as you're moving forward with implementation. Next slide. So when you go to the resources tab, and this is kind of the landing page that you'll get to, one thing that we'd like to just clarify a bit on that page is that you are very welcome to use these resources. Are freely available for people to use, and you don't have to ask our permission necessarily, but we do ask that you cite, review and cite our Creative Commons license, which is listed here on the landing page. Just so that it's very clear that everybody understands, as some of the things Peter mentioned is, we want people to stick with the way the framework's been developed and so forth, and not make those changes. So the license is very clear in what it specifies, makes it the IDDSI and not sort of a modified version of that, which is not what we want. We want it to stay clear for everybody, because that was the whole sort of premise of IDDSI, is that we don't want confusion with people. Next slide. When you click on that tab, it will bring you up, and any of you who've maybe gone on this resources page previously might notice that it's had a little bit of a makeover. And part of this was just to make it actually a lot easier to find the kind of tools and information that you're going to need. And this has really come up because we are working as hard as we can to develop further tools and to develop more things that become useful. And we certainly appreciate it when participants and people bring forward either ideas or questions that have helped us in terms of moving forward with figuring out, oh, actually this tool might be quite useful for that. So this has been organized into some different sections, and I'm going to go through a couple of these particular sections for you, just to give you a bit of an idea what happens when you click on the plus there. Next slide. So under implementation, you'll see a number of different headings there of things that you can. And one of them that I'd like to highlight a little bit, it's one of our newer tools, which I think people are going to find incredibly useful just in terms of in the implementation phase, but also really I think as you move forward with the whole idea of quality assurance. So audit sheets are wonderful tools that will help you go through the process of looking at what the diet is and what the foods are and the liquids are in your particular facilities. We have them for all the levels, with the liquids sort of being grouped together under the testing methods. And we'll go to the next slide and show you an example of that. So here you can see we have minced and moist audit testing sheet, and what's nice about this is it beautifully summarizes just a few important criteria around things like what does it look like, what's the appearance of a minced and moist consistency, and then the actual critical tests that you need to be using when you are actually checking to see does this particular food item meet the criteria. And I think that is one thing we wanted to highlight, is people have sometimes not realized that in fact you need to use all the critical tests, not just one, because minced consists of both very specific criteria around particle size, but also levels of moisture. And you need to actually look at both components of that in order for the food to be at the correct level. You'll also see that we're looking at things around temperature, because we know things like temperature do affect foods and how they appear and their consistency over time. So looking at it at the time of service, also 15 minutes and 30 minutes after serving, because we also know that food doesn't always get served and eaten immediately. So it gives an opportunity to do that. And as I mentioned, I think this is also going to be a very useful tool for doing that quality assurance process down the road after people have IDDSI implemented into their organizations. Next slide. Other things that we feel are going to be very useful are a lot of times the menu cards, or being able to sort of quickly have a visual that help either food service workers or say nursing staff understand and know what level of diet somebody is on. So we've created labels that have each of the different levels listed there, along with the triangles with the colors and the numbers, as well as the wording in there. And those can be downloadable and printed and then used as labels to be quickly stuck on menu cards. So again, a way of sort of making it a lot easier and preventing and stopping people from having to reinvent the wheel each and every time. Next slide. One of the other things for food services in particular is that the computer software that they use don't always allow for the full terms to be used in the dysphagia diet. So because these are used in that, we needed to have some kind of a way of looking at how do we abbreviate that. And we'll just go to the next slide. And here is the, here are a list of the abbreviations that we have come through. This was developed with input from health providers, food service staff, and IT. And we really had to think through what made the most sense, and also to be sure that the abbreviations didn't cross over with other kinds of healthcare abbreviations, so we didn't want to cause confusion. So again, these are also available for use and are something that can be brought in, because we know this is another important component of working towards implementation. Next slide. We know that many of you who are on the call may be the ones who are champion or leading the charge with getting IDDSI into your facilities, and it's important to help people understand a lot about IDDSI. So we have created some presentations that you can download and use when if you're needing to do awareness ends of things with food service workers or perhaps administrators, being able to sort of share the information in a nice, concise way. So we've developed all these tools for you and presentations that you can take forward and use and not have to, again, reinvent the wheel. Next slide. The other thing we know is that government agencies and administrators, along with many others, often want to see the evidence. Why should you change? Change is always challenging, and is, you know, it is clearly going to require a lot of effort and time, and certainly there will likely be some cost to some of these things. So people want to know why, what's the value that they're getting, and what's the evidence to prove and put behind this. So you can go to any of our publications. As Katrina mentions, all of our publications have been open access, and you can easily download them and review them and show them to those who are interested in knowing more about the evidence. And so we provide those for you under our publications tab. Next slide. We also know that sometimes just watching a visual is much easier than reading a lot of words. So we have a YouTube channel that opens into, it'll open up into a new window, and we go to the next slide. Here are some of the videos that have been created, and they demonstrate the testing methods that we can use. So sometimes those are really wonderful teaching tools and easy ways for people to look at that, both for patients and families if you work in an outpatient facility, but also for food service and people working in that, or nursing staff. So it makes for an easy way for people to better understand what we're actually saying and getting at. Okay. And finally, Peter mentioned the IDDSI app, so don't forget to download that and encourage others to do that as well. Families and patients may want to have this as well as anybody that you're working around with. Simple way to do it. So I'm just going to pass this back again to Peter.
Thanks, Jan. So we talked about becoming familiar with IDDSI, using our website, using the app, getting to know the detailed definitions. And the second thing we really do encourage people to do in these 10 simple steps is really to form a team. We know that it's impossible to do this on your own. So whether your team is a group of people that's just within your organization, or the team may be several organizations coming together with team members from various professions and areas of practice, and then make sure that from that group, you think about a core implementation team. And the reason why we distinguish these two is not every single team member might participate in every single meeting or every single discussion, but you really do need a core implementation team that is focused on making sure that you are always the most up-to-date with any IDDSI resources that are available to you, any recommendations that come through perhaps other organizations or from other learnings of national implementations, example being Australia and the United Kingdom and the United States are also going through the implementation process, so that there may be some wonderful learning that needs to be passed on. And that's what this core team can do. And then, of course, we recommend strongly that the team meets with the leadership team or management team to discuss the support for IDDSI implementation, that they understand the importance of using consistent terminology to improve patient safety. And then this team would be responsible for putting together some plans for IDDSI awareness promotion. And Jan's already walked us through some of the items that are available on the website, particularly the IDDSI presentations that you can download and use as quick in-services. We're also hoping to turn those presentations into videos that can now be also available on the IDDSI YouTube channel. So you will have two different options of being able to either present the presentation yourself or just simply show a video. Point number 3, spread the word. We have the What is IDDSI print and post posters available on the website. Again, something as simple as just downloading that poster, printing a few copies of it, and posting it, well, somewhere, perhaps not everywhere. So what we're hoping will happen with this call, we know we have over 100 people on this call. If everybody were to post 5 posters, that's 500 IDDSI messages that would get out there after today's webinar. So we encourage you to do so. And then schedule and deliver short presentations. We already have the What is IDDSI and Why IDDSI and the testing methods presentations available. So please make use of those now. Number 4, we ask you then to, as a team, check out the food and drinks. And here's where you take a look at your current food textures and your thickened liquids. This is an area that we know many people are quite fussed about because they're conducting a full menu review, they're testing recipes. And I think one of the things that we've learned from some of the larger organizations in the United States is that they are doing this by small teams. So someone had asked, well, how do we access the long-term care action group that was mentioned earlier? That group is coming together to look at common menu items, common recipes, and then they're doing a comparison of the common recipes and menu items to the IDDSI detailed descriptors. And from that, then we suggest make a list of the items that will need modifications to meet the IDDSI descriptors. So one of the ways you can do that is actually by making use of some of the testing methods that we have available for you. Most of the people on this call were quite confident that you're familiar with the IDDSI flow tests. If you're not, examples of the flow testing video are available on our YouTube channel or through the IDDSI website. And so this is a good way to empower your staff, empower your patients to check for the liquid thickness. And to distinguish between level 3 and level 4, the testing method that can be used is the fork drip test. And again, instructions for this is available in our testing methods document. So to map IDDSI levels, here are the current terms that some of us might be using across Canada. And here's what the comparative equivalency might be. And you'll see, particularly for level 5 and level 6, it's an equivalency simply because of the particle size stipulation and also how the foods allowed have been defined in the past. We know that many who have used minced texture diets or finely chopped diets in the past have also allowed for the use of sandwiches. And in this case, with the 4mm particle size, the use of bread isn't conducive with IDDSI level 5. And it's not conducive also with IDDSI level 6 because of the particle size of the 15 millimeters by 15 millimeters for adults and 8 millimeters by 8 millimeters for pediatrics. So we recognize that that is one area that still needs to be worked through. How do we determine if somebody can have sandwiches? I think the biggest concern is, and we hear this a lot, is when we change over to IDDSI terminology, does that mean that we can no longer give people sandwiches that are currently having sandwiches? And the clear answer is no. We do need to come up with a standardized assessment evaluation process to determine how we can ensure that people who are using sandwiches now and receiving sandwiches now continue to receive sandwiches, and how do we actually assess that and document that so that this isn't going to become such a significant change that we deter people from eating the food that they may have been enjoying, that they have been managing well with, so that we can optimize their nutrition and hydration. So that is one area we know that we still need to do some work on, and that's what this prepare phase is all about in Canada. The other testing method that we can use is the spoon tilt test, and many people have asked the question around, well, what is it that I'm trying to determine with the spoon tilt test? And what we want to emphasize is that the spoon tilt test helps us to determine the cohesion or cohesiveness of a product, how it holds together, because we want the ideal bolus to be able to travel together through the oral cavity, through the pharyngeal area, and safely into the esophagus. And then the other aspect that we're trying to determine is how adhesive is the product, how sticky is it, what is the potential for it to leave residue behind, whether in the oral cavity or in the pharynx, so that we reduce the risk of post-swallow aspiration events. And so that's what the spoon tilt test is about. Again, many people have asked, well, if there's just some residue left on the spoon, is that still okay? As you'll see with the pictures at the top of the screen, a thin coating left behind on the spoon is absolutely all right. Whereas if you get a big thick clump left on the spoon, this is where we are saying that that product is too sticky and has the potential to leave post-swallow residue. Another testing method that we have developed to determine particle size, and again, this is something that you can apply to the food and drinks during your testing method, is just by using a standard dinner fork. And we know that when particles come through the tines of a fork, it typically will measure 4 millimeters because we have measured a lot of forks during our days. And then for pediatrics, it's half of that. So we would expect that 2 particles would have to fit through then in between the tines of the fork. In terms of determining softness, and some of you have already heard this, but for those of you who have not, what we're looking at is just applying enough pressure on the blade of a fork until the tip of your thumb blanches, or meaning the tip of the thumb turns white. We know that that's about the equivalent of 17 kilopascals of pressure, and knowing that typical oral processing and tongue compression is between 15 to 20 kilopascals of pressure, we know that that will be enough to start to break the food down, as you can see in this illustration here on this slide. So become familiar with these testing methods. And then once you've done that food and drink evaluation, we do recommend that the group comes back together, convene, and think about who else needs to be involved and invite them to participate. So is it the nursing team? Is it the medical team? Is it a representation from your food services staff, the nursing support staff, therapeutic recreation, because a lot of times recreational activities involve food? Is it the patient counsel that needs to be involved. And then really at that point, develop a plan to address those changes that are required for IDDSI implementation, and divide the quote A for action list. And we really emphasize the action list, and really go at it and try to conquer those and do it one step at a time. Again, we emphasize that little steps along the way, and evaluation and monitoring, and that's why we use the term monitor, aware, prepare, adopt, because along the way we're asking people to monitor what the progress is like and also evaluate what the progress is like. And so this is where it's important to do a check-in and a checkup. Look at the list that you've created, think about what it's accomplished, make sure that we coordinate our efforts and actions so that we don't end up duplicating the efforts and using up more energy than we need to, because we know that it can be quite overwhelming, again, if you're trying to do this on your own. Then once we've done that, turn back to focusing on the food and drinks, because hopefully once you've evaluated some of your menu items and recipes, then we suggest have some fun, host an IDDSI eating and drinking party. Try out some of the new recipes, try out using the audit tools and checking the items at the time of service, 15 minutes after service, and 30 minutes after service. And you may want to assemble little teams of IDDSI audit groups. Have a little competition in terms of how the audits are done. Determine the location where you would do the audits, the frequency, the timing of the testing, and then from the results, develop plans to look at, well, how would we actually need to modify the food and drink further. And one of the most important thing to do, I think, is once we've looked at how all of the food and drinks need to be modified, it's actually quite important that we think about the who gets what. And I'm going to turn this over to Katrina at this point, just to let her comment on this a little more.
Thank you, Peter. So I'm already getting questions on the Q&A that really speak to this issue of how do we decide which levels are safe and suitable for a patient? And I think that one of the things that will evolve over time and needs to start happening is that those of us that are involved in clinical assessment need to take a step back and ask ourselves which components of the tasks that we include in our assessments are going to help us answer those questions. So one of the steps that might be relatively straightforward in planning an assessment of swallowing would be to make sure that you have a variety of items on the test tray that speak specifically to the IDDSI levels, so that if you're concerned about aspiration of liquids, you would have available a slightly thick liquid, a mildly thick liquid, and so forth, so that you can collect valid information. On the food side, I think the challenges are a little bit greater. I think that we need to do some development of valid assessment methods for specifically looking at choking risk, which is a big, big concern. And I think one comment to point out here is to emphasize that IDDSI is intended for people with dysphagia. So there may be other people in your facilities who benefit from texture modification, but for reasons that are not actually dysphagia. And so here, I think a question is the very many seniors who have dentures, for example, may in fact have a choking risk related to that, or they may not. And that determining that question will be critical to deciding whether they need to be on an IDDSI level, level 6 or level 5, so that the food is modified and no longer a choking risk. So this is an area for development, and as Peter's pointed out, those of us clinically will need to be making progress. The other thing is that we need to start the dialogue in terms of monitoring safety risks related to texture modification deliveries. So Jan's already pointed out the audit tools, but I think this project opens up a really innovative and huge opportunity for monitoring safety at the mealtime more closely. The truth is that we've had an unmonitored risk situation forever. And there's been a lot of well-intended helpful modifications or changes made at the table or at the bedside without the kind of clarity and information that the IDDSI definitions and descriptors bring. And so streamlining us towards a situation where we'll be able to ask, was it the texture that was a problem if there's an adverse event, becomes important.
Thank you, Katrina.
Yes, great. So then moving on to the next slide here, we recommend the final stage is about pulling it all together and really continually developing an action list with accountabilities and a timeline so that we all move towards launch, which is the final stage. And next slide, please. As I've said, we'll be working nationally towards a implementation date of January 1st, but locally you may have launch dates for specific components of your implementation project that either precede or follow that date. And as you approach those transitions, obviously publishing information, informing people, and really celebrating and publicizing the project becomes important. So the final slide is, as Peter said, this is a draft, and we are working on actually making this 10 steps available on the website, and there's a more detailed implementation guide available on the resources section. Peter.
Thank you, Katrina. Just to show you an example of what the detailed implementation guide looks like, we have been working very hard to try to get this out to you as soon as possible. And the overview will be a guide that outlines things to consider from a food service catering perspective, clinicians, healthcare professionals, and then as well as industry partners, manufacturers. And so the draft document at this point has all three of these groups identified together because what we're looking at is the coordination of the to-dos in relation with each other, specified by the number of months to go towards implementation. So please bear with us. We appreciate your patience. This is going through a final polishing stage. We're trying to get it into a format that is much easier for people to read and making it so that it's not so overwhelming. And that's why we developed the 10 simple steps for people to use as a starting point. And then to break it down, we will then have different sections available. If you're a clinician, healthcare professional, it would then be broken down into a simpler document like this, where you can capture notes and action plan, similarly for food services, similarly for industry and manufacturers. Jan, over to you, please.
Okay, so one of the things we're very excited about is our new webinar series, which has allowed us a forum to share implementation stories and other information from around the globe. Some of you might have participated in the first sessions that we had held in February. We had two excellent presenters from Children's Hospital of Orange County who shared their implementation process. Our next presenter will be Chelsea Robb, a dietitian from New Brunswick, sharing her story about a long-term care facility implementation. And so I think these are very useful ways to get the word out and listen to how others have gone forward. And I think you'll begin to see some of the kinds of themes that are occurring as people are working towards doing that. If you're not able to attend, we are planning to have our webinars posted on, recorded and posted on the website. If you can't get to a session, you can always download it later. Next slide. And finally, we want to stay in contact with you. And so it's really, I think, one of the main ways that we try and keep people up to date with all the things that are coming up, the new resources and information, is for sending out our e-bite, which we try and get out about once a month. And so if you go to the Contact Us tab and the Sign Up for News, and next slide. And here's an example. This was our last February e-bite. We try and just give a short update on certain kinds of things or topics that have come up, and just keep you up to date on that. So we encourage you to sign up for that, and also to think about if you've got a story or something that you'd like to share with the world. Send us your stories, and we'll be happy to take a look at them and consider putting them up on the website. Back to you, Peter.
Thank you, Jan. And finally, just a very, very quick thank you to the IDDSI Board of Directors. Just in case you haven't seen, this is the crazy group of volunteers that work tirelessly from around the world. We are all from different walks of life. We support people from the newly born to those who are waiting to go to the next world. And we are all from all different professions, and bring together the level of expertise to be able to develop the resources. And it's this group that's helping to guide the facilitation of implementation globally. So you see that we are very privileged in Canada to actually have 3 of us represented, and no, we didn't buy our way into this group. We were just crazy enough to volunteer. So at this point, before we go into questions, I'm just gonna quickly thank Jan and Katrina for taking the time to be on this call. They're not being paid for it because we're all volunteers on the IDDSI Board of Directors. None of us actually get paid a single dime for the work that we do on the IDDSI board, but we absolutely enjoy what we do. And we are here to try to support you, to support the global implementation of IDDSI. And that's why we have webinars like this, where everybody can actually access. And so we encourage you to tell other people about the availability of these webinars, and help us to spread the word about IDDSI. At this point, we're going to go on to doing some Q&A. And so if you do have a question, once again, just reminding you, there is a button on your menu bar at the bottom of the screen. If you don't see it, just move your mouse or cursor down towards the bottom of the screen and it should appear. And in the Q&A section, please feel free to type in a question. So we'll address some of the questions that have come in to us at this point. So one of the questions that came through is, how do we access the long-term care action group for IDDSI implementation resource sharing? Thank you very much for that question. At this point, the long-term care action group is just getting assembled. And what they're trying to do is to put together some of the common questions that have come in. They're trying to work through some of the I guess, the ins and outs of how do we deal with things like sandwiches for those who are currently having sandwiches, or baked goods because they don't fit the level 5 descriptors or level 6 descriptors. And so we are working with the long-term care action group. For those on this call who would like to volunteer to participate, may we suggest that in the post-webinar survey that you leave us a comment or send us a comment to webinars@iddsi.org. Before we go on to the next question, just to talk to the audience about the fact that we often get overwhelmed with questions immediately after the webinar. If your question is pertaining to IDDSI descriptors, may we suggest that that you actually check the frequently asked questions section just to see that if there is an answer already available for your question before sending us a question through the webinar@iddsi.org email. Thank you very much. The next question that came in, for those sites that have already successfully implemented the IDDSI diets, do you know how often these diets are ordered, and was patient satisfaction monitored? Katrina, were you going to answer this question?
I wasn't, but I can.
Oh, okay.
I've been typing answers to some of the questions that have come in already. I was going to say that I don't think we are yet aware enough of any monitoring of this, but the one thing to clarify is that a diet order often has different components. Very frequently the nutritional specification comes first, so things like low sodium or gluten-free, those kinds of things. And then what we are recommending is that the food level will come next, followed by the drink level, so that if we were looking at minced and moist foods and mildly thickened liquids, it would be a level 5 for food, level 2 for drinks. And one thing to perhaps point out is that we actually at this point believe that what we're doing when we say level 5 and level 2 is specifying a range of fluids and foods that are suitable for that patient. If somebody's on minced and moist, it makes logical sense that they would also be able to receive level 4 and level 3, and in this case level 2, so that in fact they would be able to tolerate a variety of levels from the framework between those specified boundaries.
Thank you, Katrina. I think the other part of that question was also, do we know how often these diets are ordered? And the answer is no, I'm afraid we don't. The Long-Term Care Action Group is actually in the process of trying to gather some of that data to try to see the frequency of the current texture-modified diets that are ordered, and they're wanting to now compare it to what would it look like if IDDSI levels are in place, and how would that change? So for the person who asked that question, again, please be patient with us. We are trying to gather that information, and then hopefully what this will lead to is to also look at patient satisfaction down the road as well. So thank you very much. The next question was, does the website have tested recipes available? And the answer at this point is no, we do not have tested recipes at this point. We know that different organizations are working on testing recipes. We're hoping that there would be some means of being able to share these recipes. And so if people on this call have proven and tested recipes that they would like to share, we would encourage you to send that in to us. We are most happy to acknowledge you for sharing those recipes. And we would also say that this is a great vehicle for being able to also get feedback from others as they try the recipes that you share. So please don't be shy. We really do hope that you will be able to share those recipes with us. One other question that came in is, what progress has been made with suppliers in not only labeling, but also in providing prepared products to meet the IDDSI guidelines, especially for minced and moist and soft and bite size. Thank you for that question. We know that the suppliers, the industry partners are working hard right now to test their products, to modify their recipes, and to be able to then say to consumers that these products have been tested and that they are designed for these different IDDSI levels. But having said all of that, again, we emphasize to everyone that at the end of the day, some testing still needs to happen at the site once the food has been made and served, just because we know that food properties will change over the course of time with temperature, with loss of moisture content. And so simple answer to that question is yes, manufacturers are in the process of working with this. We are already aware that a number of the thickener companies are already using the transitional labels, meaning current terminology as well as IDDSI terminology. And we were told by the suppliers in Canada to expect some of that transitional labeling very soon, as soon as I believe April of this year. So hopefully you'll start to see some of that IDDSI labeling coming through very quickly. There was a question that pertains to, is Dietitians of Canada or CSNM going to be lobbying the provincial government for increased food service worker hours? Thank you for that question. I'm afraid we don't have the ability to answer that question. We are asking perhaps that that question be posed to Dietitians of Canada or the Canadian Society of Nutrition Management, so that perhaps they, on IDDSI's behalf, can help to lobby. So thank you for that question. Which companies have been on board in Ontario and are already using IDDSI? If you go to our sponsors page, all of the companies that are on the IDDSI sponsor page, we are aware are already in the process of transitioning to IDDSI terminology. We are further aware that there are some companies that have been in conversations with us who are not current sponsors, or at least we hope not yet. We hope they will come on as sponsors, are already using IDDSI. If you are questioning about whether or not a company is using IDDSI or going to be using IDDSI, may we suggest that you communicate with them and ask them about IDDSI, and in return help us to promote IDDSI to them. So thank you for that question. There's a question asking about what foods would you recommend putting on a tray to determine a resident's acceptance to the different IDDSI levels and descriptors. I'm wondering if I can turn this over to Jan or Katrina.
I'll take it, sure.
Yeah, thank you.
I don't think we have a firm recommendation here yet. I think this is a perfect project for collaboration between speech-language pathologists or whoever the dysphagia assessors are in your facility, in collaboration with the dietitians and food service kitchen to construct a representative array of foods and liquids from your facility that will help you to know exactly which levels are suitable for that patient. I think this would be a great thing for sharing down the road, either through the website or at conferences and posters, that sort of thing.
Thank you, Katrina. Another question on how do I join the long-term care action group? I would like to participate. And we see a couple more questions in the similar line. Could we share the volunteer opportunity again? If you don't mind, for those people who have sent in those questions, please forward your names to us and simply just say, we would like to participate. We'll make sure that we forward your names to the organizers of the Long-Term Care Action Group. Sadly, at this point, we do not have permission from them to release any of their contact names and emails, but we will be happy to facilitate the introduction of you to them. One of the things that we have to be careful as an international organization is to be respectful of the freedom of information and email regulations. So for those on the call, when you sign up with us, we do not freely share your email or contact information. We do not spam you. If you volunteer your information to us and give us permission to connect you, we will be most happy to do so. So it's actually a few minutes past the top of the hour. We know that we have only scheduled this webinar for a 60-minute period. We thank you for staying those extra few minutes with us. Once again, we remind you to please complete the post-webinar survey that will be coming your way in the post-webinar email to you tomorrow. And for those who are interested in participating as a volunteer, please email us at webinars@iddsi.org. Provide us with your contact information, and we would be happy to connect you with the recently formed Long-Term Care Action Group. We really appreciate everyone's attendance today. And just a reminder, once again, that the webinar has been recorded and will be made available through the IDDSI website and on our YouTube channel. We thank everyone once again, and we bid you all a wonderful day. Thank you very much for being on this webinar.